everyone. Welcome to NCIA's October webinar. This is the cannabis pet industry, what to know and what's for show. My name is Chris Olson. I'm the education manager at the National Cannabis and Industry Association. Before we get started, I want to remind everyone there's a chat feature at the bottom of your screen. So as we go throughout this webinar, you can pose questions and the presenter will take those questions at the end. So joining us for this webinar is Dr. Zac Pilossoph. He is the Chief Medical Officer at Consultants, Inc. He's a fear-free certified humanitarian veterinarian. He's also a harm reduction cannabis education specialist and consultant. So here to kick it off is Dr. Zac Pilossoph.
Hey everyone. So thank you very much for joining today. This is an amazing opportunity for me and just a really amazing opportunity for the world in general. This is an important topic. With the booming and growing cannabis industry, we're surrounded by both true and false information every single day, no different than any other industry. And so it's just important for us to know what's right and what's true. And so I'm definitely happy to be here today to kind of just give a brief overview of what's out there right now that we can rely on and what's not. So much so concrete yet, but maybe in the works of becoming more and more profoundly trustworthy as well. And so again, huge thanks to NCIA today for giving me the opportunity, for collaborating, for synergizing our missions. It's all about education, guys. And so there's no better platform to join up with for this mission and purpose. And so it's just a really, like I said, an amazing opportunity for me and for the world today. And so again, thank you very much. And without any more delay, let's begin. So that's just an introduction. We already went through that. So, you know, we talk about it all the time, and I want to just touch on it quickly again, how important it is to know that there is a system in our body that we have had since the beginning of time that is involved with almost every other system we have. It's truly fantastic. It's truly amazing, and it's perplexing as to how long it's taken to realize it's there. But regardless of that, it's just amazing the breadth of influence that the endocannabinoid system has. But just to give a 5-second synopsis, it's basically what's considered the homeostatic regulator system in our body. It's extremely diverse, concentrated highest in the central nervous system, but the receptors are found and the ligands that are involved with that are found everywhere throughout the body in almost every organ system, both in normal function and in dysregulatory functions. The system is found in all chordates, meaning that's animals with a backbone, and then also found in many other animals as well, just maybe in different concentrations of different receptors versus the molecules floating around and or different components. But the main three subcategories of that system are like I touched on, are the ligands, or the molecules that float around and that are produced on demand, which are your endocannabinoids. Specifically, the two most that are studied are anandamide and 2-AG, or 2-arachidonylglycerol. There are many others, some in different proportions of concentrations, but nonetheless, there are others that we will continue to study and find out if they have specific versus general roles as well. Anandamide has been seen more often to be of the endocannabinoid that is produced on demand, and the concentrations will fluctuate. Whereas 2-AG seems to be the one that's produced at a consistent concentration and frequency throughout the body when it's needed in the sites that it's applied. The second category is the enzymes that both create and degrade those endocannabinoids. So for 2-AG, the breakdown enzyme is monoacyl glycerol lipase, or MAGL, whereas for anandamide it's FA, or fatty acid amide hydrolase. And again, these are in different concentrations depending on where they're needed, if they're needed more or less. And in just to give an idea, in the neurologic system, it's found oftentimes in the neuron that is presynaptic to where the molecule is binding to. And then lastly, the third category is the receptors, or the little lock and key, the lock portion of the ligands. And the most common studied, obviously, as we know, are CB1 and CB2 receptors. And these are, the CB1s are, again, primarily found in the neurologic system, but the CB2 receptors more in the periphery. with immune cells and organs that store those immune cells, such as the tonsils and spleen being of the highest concentrations. But the overlap that exists with other receptors, such as the TRPV receptors, the adenosine receptors, serotonin receptors, and then some classes of G-coupled or orphan receptors are considered are all places where these endocannabinoids have influence and can bind in partial or full agonism or be subject to antagonism. The endocannabinoid system components, like I said, are present all throughout the animal kingdom, although chordates are the ones that, where the backboned animals are like us. Almost every single categories of animal has them. The exceptions to that are listed there. So sponges, which are the most simplest of phyla, and insects, which are an interesting exception to the rule. They seem to not have components, but and with other animals, such as some type of flatworms not having them as well. But for the most part, and again, it just goes to surprise us all that it took so long to figure out that this system exists. But yet that is the case, and we're working on finding out just how important it is in every class of animal. The other topic that's mentioned throughout the cannabis buzz is then the complementary phytocannabinoids, cannabinoids that are made by a completely different kingdom, the plant kingdom, that then synergize and overlap with our system. It's again fantastically perplexing that the molecules produced by a plant would have a synergistic influence on our body, but it does exist, and it's not just cannabis; it's many plants. Through the molecules they create, both phytohormones and exogenous molecules, they can help us in multiple ways. But for cannabis itself, the cannabinoids are the ones that are of most interest. Obviously, there are other subcategories such as terpenoids and flavonoids, but those are produced in other types of plants as well in high concentrations. The cannabinoids are made in other plants in much smaller concentrations, but are in most part made by the cannabis sativa plants. So the big ones that are made are the acid forms, the CBDA and the THCA, along with CBG and CBN and CBC. There's over 185 plus cannabinoids that are made in these plants, but these are the ones that are in highest concentration and most talked about for the medicinal therapeutic properties today and going forward. And like I said, the human cannabinoid receptors, the endocannabinoid receptors are the same as all other animal receptors. So, the receptor distribution, the density, the metabolic breakdown, et cetera, may be a little different, but overall, the phytocannabinoids work in a way. And to the right there, you can see some pictures of them, but they do work in a way to enhance the different cell types within our body, as we discussed, the neurologic system, the immune system as such, and many others. So like I said, this talk is going to be kind of like of a clinical approach. So I'm a clinician by trade. I obviously do some research and some self-research as well, but primarily what I wanted to give today is a clinical understanding of what it really means to start reintroducing this medicine into our cabinet of sorts, to have this as an option, whether it's a first or second rate option or beyond. This is important to know because this is where the bridging occurs between subjective reports of people using it on a one-on-one basis, between the research that's done in the laboratory, and then now to get to the actual mission of it all, which is to treat patients and to help patients enhance and to create equilibrium in dysregulated situations. So again, the clinical applications is what's truly important to, at least to me, because it then allows us to use the molecules in the most effective way. And so again, there's a repeat in the pattern. It's extremely similar to humans in animals as it is to address certain conditions, from the reports of anxiety control to neurologic conditions to spasmodic conditions, et cetera. The applications are going to be very similar. It's just a matter of slight differences in a couple of points. But the subjective and objective data continues to be built over time. There's a lacking of evidence-based medicine in the veterinary field versus the human field, but again, that's because of sometimes with funding and sometimes with other factors. But but there is evidence there nonetheless, which we'll go through. There's though other research papers that maybe aren't considered prospective research papers, but they were used in phase 1, phase 2 studies for when the mission overall was to understand the application of cannabinoids in humans. Those research articles, although they're not specifically end result prospective studies, should be considered as evidence that this is working. And so we'll touch on that in a couple of minutes. However, what has been done most often in the veterinary field right now is studying the toxicity symptoms and the treatment that is required for when cannabis is used in maybe a fashion or is ingested as such accidentally, that it creates unwanted side effects. So we do have some studies in that area that are a little bit more robust than the actual medicinal, therapeutic, palliative, etc. use, but still nonetheless help us to paint a picture that there is reason to work in a stepwise fashion when considering cannabis, whether you're a human or an animal. So, like I said, the objective data that exists, the primary data is through laboratory animals. Rodent models are the ones that have been used since the beginning of time with studies. So we do have some good data that comes out of rodent models that were done in phase 1 studies, and then other animals that are used, such as rabbits, ferrets, dogs, and cats. Those are, again, they have been in certain amount of papers that are published, but primarily the rodent models exist. But rabbits, you'll find, are something interesting that we'll touch on again in a little bit. But for the the companion animals we consider, those do have much less of a robust database. But again, we hear every single day great stories from pet owners, just like with humans, of a clinical response and a significant response to cannabis therapy when it was used in a self-medicated form. And self-medicated in the veterinary field is a little interested because the animals aren't actually medicating themselves, but they are in a way under our responsibility. So we are self-medicating our pets. It sometimes doesn't communicate over as we would think it would, but it is what I would consider self-medication. And we hear all the time, and this is actually the reason I'm sitting here, is because I finally got a little, frustrated that I was seeing these positive reviews and these amazing stories, and I was like wondering exactly how this could be, how I'd never learned of this in school of a significant amount, and pure curiosity is the reason why I'm sitting here with you after these subjective stories came back to me. So these are a quick list of the research, the primary research, not prospective studies in animals of sorts where it would be considered an animal specific study, but these are studies that a list of clinical studies that were done to show the positive influence of cannabinoids. And the research, the research article that I have there in a paste form is a really great overview I found that does list multiple studies that were done over time and puts them in a review form. And the topics that are touched in there are glaucoma, which in rabbits was done in 1998. So literally 20 years ago. Again, they say there's no research out there, but 20 years ago, it was shown to have a positive influence by using cannabinoids to help treat and control the symptoms of glaucoma. The next study as well, next to that, and the one after that, then also touched on with monkeys, showing the benefits of cannabinoids in the eye topically to control glaucoma. Dr. Michelin, our father of cannabis, did a study in 2005, which actually took information from decades prior to that even, and showed that there are cannabinoids that have antibacterial properties, as we know, along with some terpenoids. There are certain terpenoids that have antibacterial properties, but cannabinoids do as well. It's what the plant is making them for. It uses it for a physiologic purpose, and so antibacterial properties is one of them, and we've been able to prove that through clinical testing. Pain and inflammation, an obvious one on the list. We've seen some fantastic stories from humans using it for inflammatory conditions, both immune-mediated, autoimmune, neoplastic, and then just general from cutaneous to systemic control of pain and inflammation. Cutaneous hypersensitivity, an important topic, specifically with mast cell disease. Mast cells are a cell type in your skin which controls inflammatory reactions through a specific route. And it's been found through topical administration in these three studies specifically, that mast cell conditions or dysregulation can be controlled in a continuous fashion, in a consistent fashion, by using cannabis. And then anti-emesis, which is actually the reason why cannabis was synthetically created in the first place back in the 80s to control chemotherapy-induced nausea and vomiting, has been shown actually since 1981 to be of beneficial use. So now we're going to switch those. Like I said, that review article and those studies that were listed were in an effort to then graduate to phase 3 studies in humans to then use cannabis. The next 2 slides are going to be studies that were actually done in animals for the purpose of finding a consistent frequency, route, dosing, et cetera, in animals to get a desired result. So the one study I start with is the study that was out of Cornell in 2018, which was looking to prove the ability for a subjective pain management, prospective pain management control in dogs with osteoarthritis. And this was as we always say, we want to look for prospective, well-conducted studies. So this was a double-blinded, placebo-controlled experimental study with 16 dogs included at the end of the study, and the results showed that with a 2 mg per kg oral twice a day dosing regimen, that there was a significant improvement in the control of pain in dogs that had been administered CBD in a controlled fashion. This study did allow for other medications to be given at the same time, I believe, but those were kept constant throughout. It was the CBD that was that was added and then removed in order to see the benefits of it. Adverse effects. The most common was a clinical effect. So ALP was elevated, which is a liver marker among other markers. It can be increased from certain metabolic conditions, can be increased through pathology in the bone, but most commonly is seen in liver dysfunction, but no signs of clinical signs of liver dysfunction were seen. It was just merely a result of a blood test. Other things that occurred were maybe some upset stomach, some reduced appetite, but that is subject to maybe being cannabinoid induced. But again, the carrier molecules that are used, the lipid emulsion that increases the absorption rate, that easily has been shown in dogs to also create an upset stomach. So that's a variable factor that should be controlled in the future when we try to find further studies that enhance the control of pain management. Second study that I'll highlight, which again was a double-blinded placebo-controlled study, was done at Colorado State by a researcher and a clinician named Dr. McGrath, who helped to prove in a fashion that cannabinoids can be beneficial in animals as well for seizure control. And so these were client-owned dogs, so not research dogs, that had a history of seizure activity with being put on other anti-epileptics throughout their life. And they were then given the opportunity to see if CBD would help with controlling, and turns out that it actually did. The paper goes into specific numbers, but it did show that there was an improvement in seizure control with the control group, or the group that didn't get cannabinoids, also showing a result of reduced seizure activity. But again, placebo effects are thus noticeable in the human and animal fields of research, which sometimes complicates the ability to know if results are consistent. But nonetheless, there was a significant reduction in seizure activity in animals that had been given CBD, and again shows that this is of beneficial use both in humans and animals, as we've seen specifically with Lennox-Gastaut syndrome and Dravet syndrome in children that have early onset seizures. Again, the adverse effect in this one, though, was ALP elevation with no clinical signs of liver dysfunction or failure. So that'll be another interesting topic of research going forward from here, especially if we start doing healthy animals and monitoring their ALP elevations over time. But no clinical signs or symptoms came out of that ALP elevation in terms of liver dysfunction. Okay, so going forward from here, the information besides those 2 actual prospective studies that were used to prove in a research setting with owner animals, the rest is going to be more of subjective basis, but still subjective information in my view. If you have hundreds upon thousands of stories of people benefiting, regardless of the product used, that's something that we need to take seriously as a trend that is important to consider. sure what happened there. There we go. Sorry about that. But important to continue as we go forward that this is nonetheless something that should and will be considered a therapy. So the first one is behavioral and neurologic control of specifically anxiolysis and stress. No different than humans. Animals have stress. They are anxious. A variety of stimuli can cause animals to be of not their most calm state. And so CBD and cannabinoid based therapies have been shown time and time again over the last several years to be of benefit. The number one reason why cannabis is considered in animals is for anxiety control, whether it's daily workings or whether it's before they're going to have a stressful event, right before they're going to go to the veterinarian of sorts. This is a product which has been shown in subjective observation to help animals when the correct dose is given. The hypothesized mechanism of how this works, like I said, there's no study to prove it, but it looks like there's both a serotonin receptor binding activity, so specifically 5-HT1A receptors, which are inside your brain, as well as helping to increase the concentration or the lifespan of your endogenous cannabinoids. So anandamide can be kept around longer. For example, if CBD helps to reduce the breakdown of it by inhibiting Fa, or that enzyme we talked about that breaks down anandamide naturally. The next category, again, as we kind of touched with the osteoarthritis clinical study, but anti-inflammatory and neuroprotective properties. I kind of combine these two, but because they are in essence of the same general category of pathology. So inflammation is a normal response by your body, but it's the excessive inflammation that creates a pathologic situation versus it being potentially helpful. So excessive inflammation causes pain, causes redness, swelling, throbbing, etc. And then there are conditions specifically in the neurologic system in which inflammation leads to neurodegeneration. And cannabis has been seen through subjective studies to be beneficial in animals and many objective studies in humans in these two categories. So again, I talked about there's many conditions that cause inflammation because it's your body's response. So autoimmune, immune-mediated conditions and syndromes, neoplasia, chronic degenerative conditions, all of which are categories in which cannabis can, in animals, I would suspect be of beneficial use, has been benefit in humans as well. Again, there are no proven studies to support that claim. So the mechanism of action, how it works, both CB1 and CB2 receptors help to modulate gene expression through the way that their receptors work. So they are G protein coupled receptors, meaning that they're surface receptors that then lead to downstream effects in the cell. It can actually affect gene expression in which those genes go to promote the production of inflammatory cells. And so, that's important to know because those inflammatory cells can completely be eliminated from being created versus there are other pharmacologic medicines or therapies that just put a buffer or try to neutralize those molecules after they've been made. And so that's important to know because we can kind of intercept the pathway of creating inflammation from the start rather than reacting to it in the end. And what excites me the most actually as well is, so terpenoids and flavonoids, again, as we touched on, are molecules that are found in many other types of plants throughout the world. And the combination of cannabinoids, terpenoids, and flavonoids is an immensely effective concoction of anti-inflammatory molecules that can be used as the buzzword that's around there, the entourage effect. It truly does exist, and whether that's a colloquial phrase or not, what it just does describe is that botanicology, or the use of plants in order to influence therapeutic properties, has a multimodal positive influence versus just being one molecule for one problem, as sometimes Western pharmacology likes to find. And then, I just touched on the last topic, cancer, but cancer is always a topic of kind of fragile discussion. It is, again, in many cases, your body's dysregulatory function. So cancer starts by an overproduction of a cell for certain reasons, whether it's not told to divide in a controlled form, or the cell is given the signal to multiply more. So either a tumorigenic or an anti-tumorigenic inhibition. So the picture on the right is kind of hard to read, but it overall just kind of shows you the cell processes and the pathway that goes forth in telling a cell to make one copy of itself versus multiple copies in a dysregulatory fashion. And so, again, proposed clinical applications, no real studies out there to prove it, at least to my knowledge. But as we've seen in humans, there seems to be a positive trend in treatment of multiple types of cancers in different tissue types with carcinomas and with bloodline cell types of cancers. There's so many signs that that cannabis will be beneficial in the future through the mechanism, again, of cellular influence of proliferation, apoptosis, tumor microenvironment, all these factors that go into promoting a tumorigenic environment can be neutralized and potentially reversed using cannabis in the appropriate manner. Again, though, cannot definitively claim that is true in animals, but I'm confident that we will continue to find positive results in humans that will communicate over to the field that I work in. All right, so now from getting prospective and positive information, now I really want to bring in the what's to know, like in a factual statement. And so this is literally a cut and paste from the AVMA website as their position on cannabis in animals at present time. And so there's like a 3-page article that they put out, which has some really great explanations of why they take this stand and what the reasoning is and what the data supports at the moment. But this is the bottom line, and this is what I allowed for us to kind of just read through today. And this is free online access, so anyone can see this if they want to read the whole paper or the whole 3 pages. But ultimately, as you can see there, under existing federal and state law, veterinarians who administer, dispense, prescribe, or recommend hemp or other cannabis-derived products that are not approved for use in animals or approved in animals or people in accordance with the FDA extra-label drug use regulations face increased potential legal risk if there's adverse effect. Ultimately, what they're saying is avoid right now until we can really create true regulations, rules and regulations, and consistent quality control testing. And that's the bottom line. So it's as a veterinarian, it's a scary time. It's a fragile time to know what you can and cannot do, which is why I'm taking this approach very robustly, is to promote education. It's literally harm reduction, education, and information, factual information we can give right now. I cannot associate with a specific product, endorse a specific product, because I am an actively practicing veterinarian that has patients. And so to break any of these rules that the AVMA does not feel comfortable with allowing yet, then that is putting me at risk of what is my most valuable resource, which is to help my patients in my practice. And so I unfortunately can't take any steps beyond that, other than being an advisor of sorts of what I know that is factual information. And so, any veterinarians out there that are able to watch this right now, it's definitely up to your decision as to how much you talk to your patients and your clients and their patients and their pets. In a private fashion. But this is what it stands right now in terms of the medical association that governs us. And regardless of what the Agricultural Improvement Act of 2018 or the Hemp Act says, which I wish it was true that we could just follow that rule, I am skeptical as to what is allowed and what not allowed right now. So I am relying just on education. So this is another just an exaggeration of sorts on the right with the toxicology testing, but ultimately is another slide that's important to know that the human versus animal interaction with psychoactive cannabis effects is actually, at least in my opinion, and in the opinion of many reports of, like I said before, the toxicology clinical reports that come out, dogs specifically, since we have seen their influence or their dysregulatory response to cannabis when it's ingested in an unregulated fashion or uncontrolled fashion, they do seem to have some different spectrums of side effects. Cardiovascular, neurologic, and urinary systems are the 3 that I kind of see differently, specifically with dogs getting very bradycardic or having a low heart rate. Neurologic, they become much more ataxic or wobbly than humans do. And then urinary in dogs, they will become urinary incontinent, versus in humans, it seems to have an actual opposite effect, that it helps with urinary retention, especially in some spasmodic disorders such as multiple sclerosis. The THC is specifically the part that we are always worried about, because with the Delta 9 THC, when it's in its active form. And like I said, there are many toxicoses studies out there that have increased the reports in the last 20 years of toxicosis cases through ERs, which is where I primarily work, especially in those states in America that have made it both recreationally and medically available at a legal status. This next point though is always the one I fall back on no matter what, and that there is in humans at least no reported death with strict cannabis use, and for humans that remains true today, and in animals I would say that is also true. So in rats and mice, there are controversial studies that show with intravenous injections of something like 1,000 mg per kg of cannabinoids, there have been induced death. But based on the receptor distribution in your brain, which is why other drugs like opioids kill you because they cause severe and fatal respiratory depression and cardiovascular collapse, in the influence of the endocannabinoid system with cannabis being used, that doesn't seem to be in effect. And so dogs, cats, and ferrets, there's no strict reported death. The confounding factors, a lot of times with edibles, the cannabis will be in there with chocolate or with other sweets. Maybe there are artificial sweeteners in there that then can compound with the cannabis and then cause death. Again, though, how much we can prove that it was the cannabis itself, I would say we can't right now based on the studies and the research that I read, which is hundreds of thousands of papers. But again, there's room for further study as time goes on. So this slide is important to know that I want to 100% declare that every pet CBD company out there or company that advertises that their product is for animals, this is 100% not an attack on them whatsoever. It's literally a factual slide. And that what I mean by that is that the endocannabinoid system for humans is the endocannabinoid system for animals, and that there are ligands, enzymes, and receptors involved. The ratios, the locations, etc., those may be slightly different. Specifically, I put on cerebellum there because animals seem to have more of a concentration in their cerebellum and less in their prefrontal cortex. But again, pet CBD is a phrase that has been passed around and quite successfully actually, because anywhere between 52 to 58%, I believe, of the CBD market right now is for pet-related use. But that, unfortunately, is something that is a phrase. Whether it has scientific backing, I can't really say right now that it can. Again, though, there are important things to know about the molecular, like I said, the distribution of the molecules, the molecular breakdown pathways. So, for example, your CYP450 enzyme complex, which is in your liver, which breaks down multiple cannabinoids, that can be maybe a little slightly different in animals, in which we don't know. Maybe that's why we see the side effects we see in animals that are not seen in humans. Still areas for research. And again, like we touched on, the clinical side effects I would see if I was working my ER. But again, to touch on the pet versus human CBD, what is it? It right now, although I would say that there are certain things like flavorings and additives that can be made so that it's more palatable to an animal versus a human, it really has to do with making it a marketable option. What is it that's going to make it a human versus a pet formulated? Like I said, it's going to be additives, not the actual cannabinoids themselves. Cannabis is cannabis, whether you are a dog, a cat, a human, a ferret, a rabbit, etc. The one thing, though, on the bottom, I will say is what maybe the future is, if it's a veterinary formulated product, that could be a route that makes actual pet CBD and or pet cannabis products a thing of the future. Right now, at least to what I know, there is only one veterinarian out there that is the CEO and founder of a company that does make cannabinoids. And the reason why that is important is because I believe he is not actively practicing right now. Don't quote me on that. That could not be true. I'm not exactly positive, but out of California, a company called Vet CBD is a company that was started by a veterinarian, in which the products were formulated under his supervision as the CEO of the company. So if I had to say there was a pet CBD company out there, there are thousands out there, and I'm sure that there are products out there that work extremely well. And again, this is not a bashing slide, but this is a slide that I definitely think is important to touch on. That the only one that I know of right now, I think there's a product out there that a veterinary technician helps out with that's made for horses as well, which is fantastic. But the only one I know of on the top of my head that is made by a veterinarian, that is overseen by a veterinarian, is Vet CBD, and that's out of California. So then we fall back to this slide. This is the most important slide, in my opinion, for the entire talk because it helps you to decide what it means to choose a product one over the other. And so for humans, just for animals, just like in humans, the selection criteria for your product is exactly the same. What is the concentration of the product? Is that proven? What is the carrier molecule or molecules that is used? Is it a hemp emulsion? Is it a pharmaceutical grade olive oil emulsion, an MCT oil? Is it something else if it's a topical, etc.? Those are things that we need to consider. Do you have allergies? Does your animal have allergies to those, etc.? Those are important when you consider carrier molecules. Ancillary qualities such as smells, such as tastes. Some things are not palatable to an animal that are palatable to us. And honestly, I've seen occasions where humans choked down a tincture of sorts because some of them do taste a little interesting. Not all of us are enjoying the flavor of that tincture, but again, there are certain ways you can make it more palatable and more flavorful. But those ancillary qualities are important to consider. If your dog is spitting it out, then you're not getting the results that you need from the self-medicated cannabis qualities like you would want. The recommended amount of administration. So how are you giving it? Again, is it orally like most products are right now? But topicals, if you apply a topical, is your dog licking it off? Like if it's not meant to be licked off, what are the other molecules again that are in there? Is it safe to be ingested? That's important to consider. The frequency of administration, the 2 studies we have, I believe, were given twice a day. Is that enough? Is it the skin of a dog, for example, is much thicker than ours? Is it penetrating that skin to get to the nerve endings in there, or is it kind of just a waste of time in that it's aesthetically and maybe a superficial aspect? But again, do we know? And then the last one is the one that's most important for safety. So in 2017, the ISO laboratory standards were revised and put in place. And this is, if you ever have to fall back on one thing, it is that you should look for a product that is tested and proven to be safe and effective through an ISO 17025:2017 certified lab. These are found throughout the country in multiple states. Florida, here where I live, there are 3, I believe, maybe more to come. But again, this is the most important thing because this proves that what you are ingesting or what you are applying topically or etc., the other routes that you are using it or using it for your pet, that you are hopefully getting what you want to get, and that there is nothing in there that will harm you in a significant way, such as toxicants or fungal bacterial agents, etc. Look for this if you can. If this is anything to fall back on, is the ISO certification laboratory testing. And then specifically for dogs and cats and your pets, essentially, these are things that you have to consider as well, at least from the clinical perspective of being a veterinarian. So flavorings and sweeteners, specifically, xylitol is an artificial sweetener found in many gums, found in different candies, but it is extremely toxic to dogs at a 0.1 mg per kg dose, meaning that a couple of pieces of Trident gum, for example, in a dog can literally kill them because it causes induced hypoglycemia. And then if high enough in doses causes an acute hepatopathy or liver disease. So something to really be careful of when you're giving or considering self-medicating your pets is looking to see that product doesn't have something like xylitol. Allergies, so if it's chicken or beef flavored, those can be additives. Again, trying to make a pet-friendly CBD company. But dogs and cats and other species can have food allergies, food adverse reactions to those flavorings and I guess if they are flavorings of sorts, but if they are derivative of actual chicken and beef sources, then it can cause a food allergic reaction. And then if they're on other medications, such as NSAIDs and anticonvulsants, anticoagulants, similar in humans, those are broken down, for example, by the cytochrome P450 enzyme concoction in your liver. And if they are causing inhibition or enhancement of those enzymes, then you can see an effect or influence in those other molecules of those medications are given that can cause maybe exacerbations or reductions in their clinical effects. And then obviously the last thing would be the subjectiveness of your pet. So their signalment of sorts, their age, their size, their weight, their body condition. Cannabinoids are lipid soluble, so they're stored in fat, which is why you can test positive for THC, for example, for weeks to a month after it's ingested, because it's stored in your fat and it slowly resolves. So the body condition score, the muscle condition score, the age, the size, the weight, et cetera, takes into account the effects of the cannabinoids. And so, our ending remarks here, just to sum it up, prospective research is still needed. You will continue to hear that no matter what. But as we've seen here today, there are probably over 100 research papers or so that show that cannabinoids have a future in our veterinary community and treating our pets and our patients in a respective manner. The endocannabinoid system is the endocannabinoid system regardless of the animal species. So animals have this system, no doubt about it. Plants, specifically cannabis sativa, makes molecules which enhance it in certain ways. There are minor exceptions, but that is the rule to fall back on. And then for our specific talk here today, product selection is the same whether you are here or an animal. So look for that ISO laboratory testing. Look to see it has a trusted background and formulation product, that you can follow that product back to Rich, etc. That is how you can say that, although we still live in a pretty dysregulated industry, that we hopefully are getting something that we thought we bought in the beginning. And then, the small number of important exceptions we talked about today, pets compared to humans, the xylitol is the one I will harp on tremendously. I don't know how many products are putting xylitol in it, but especially if you're considering edibles, candies, and pastries of sorts, make sure it doesn't have xylitol in it, because that can be very dangerous if not fatal. And that's it for today, guys, in terms of what I have for you. I'm really excited that you listened in, and we'll definitely have some time for questions. And I hope I was able to help out in some way. This is a really brief introduction. Those are the ways which you can reach me. I am very available through email, phone as well. I have LinkedIn and Instagram, as was mentioned in the beginning. I'm also I'm the chief medical officer of a company called Consultants Inc. And I've now been brought on as an advisor and medical director for actually World Canna Health, to help with the education component and getting this out there for the masses to understand, and for you all to feel more safe and protective as you consider cannabis, maybe for yourself and for your patients and your pets as well.
Great. Thanks, Zach. That was really informative. Just to remind everyone, we do have a chat function on the platform. You'll see that at the bottom of your screen. So if you haven't posed a question already, feel free to do that. We did have one question that came in during your presentation. The question was, is the AVMA's policy regarding CBD expected to change as FDA guidelines evolve, or are the AVMA's policies known to differ from the FDA's positions historically?
Yeah, great question. And, I would say that first, I'm not part of the AVMA, so I don't know what their talks are behind the scenes. There's always talks behind the scenes. There's always, priorities and perspectives put into play when they are meant to be at the right time. And they're always usually pretty hyper calculated with a conservative approach. So I would say that I don't know if I can give you that right answer. There's always lobbyists, both in America and in Canada. I'm friends with the entire CVMA team up there, the Canadian Veterinary Medical Association. And then also there's a group of really great veterinarians, part of the CAVCM. So the cannabinoid Association for, the Association for Veterinary Cannabinoid Medicine Use. And so there's always push for us on the forefront of the clinician aspect to help get more evolution in understanding and acceptance of cannabis. But long story short, no, I do not know if they're going to evolve. I am pretty sure that as we've seen, as the human side has evolved, yes, we will find ways in which we can slowly incorporate cannabis discussion and therapeutic use as time goes on. But for now, it's a conservative approach, and I haven't heard anything of it being revised as time goes on. But I'm fairly confident that they will as time goes on.
Great. Zach, are you seeing any kind of leading products develop in the space so far? In humans, we're seeing certain products and edibles that consumers prefer, but are we seeing this in pet products?
I'm sorry. Can you repeat that one more second, please? One more time.
Yeah. Is there a product category within the kind of pet CBD space that you're seeing is really popular? Are dog biscuits popular to deliver the CBD? Are you seeing a kind of product category within pet CBD that's popular with consumers?
Oh, I see. Yeah. So that's an important topic to bring up, a subtopic. Yeah, incorporating cannabis into ways in which dogs and cats and other pets will like to ingest it. Yeah, it's important because, like I said, the tincture is sometimes can be an abrasive application form. The one thing we have to really consider when we're doing that is when we are cooking cannabis, it does change its chemical properties in many ways. And especially when you consider terpenoids, which are extremely volatile molecules. The so-called cannabis influence can be affected by any type of influence or change in the product's natural formulation. I think what's going to be very important as time goes on is using the natural form of cannabis, specifically its raw form, when a plant in and of itself and harvested that way. If we can find a way that there is a consistent application of cannabis without us having to worry about it being psychoactive, even though both THC and CBD are psychoactive, because if CBD is affecting your serotonin receptors and creating a calm effect, then that is psychoactive. But in terms of creating, the dysphoria versus the euphoria, I guess are the words I would use, that we sometimes see with Delta-9 THC. I think that the best way to do that is to really start looking at raw ways we can use cannabis and use it in a medicinal form. But, I think that the creativity of those creating products and formulations for animals that are looking to make it, again, palatable and easily applied and wanting to be ingested and or applied topically, et cetera. That's something that the minds of product formulators and creators and other people that are looking to get in the space have done a creative job at finding. But I haven't seen anything really in terms of that makes me say that this is the application form of choice over one over the other.
Okay, great. That's great insight. And this is a follow-up question into my question, and you might have answered this already, but we'll go ahead and pose it. Are there any other edibles products you recommend steering away from dogs specifically? For example, I know caramels aren't easily digested along with rawhides. What edibles are most ideal to consider for safe pet application? And we might not have the science for this yet. It sounds like what you're getting at, and that there's not a preferred kind of delivery method for pets yet. So, No,
it's a fantastic, and yes, I would not recommend giving caramels to your pet. That level of high sugar dose is, another topic for discussion. But the caloric necessities for a dog, depending on the size and the breed and the energy that it's expended every single day, is a caramel for them can be something like a cheeseburger for us. So we have to really be careful when giving any type of edible to an animal if it has caloric value. And so, yes, that's a good thought process. I am not, rawhides are also a controversial concern in the veterinary field, an easy foreign body that can lead to gastrointestinal upset as well as foreign body complications in the GI tract. And so in terms of edibles, like I said, I'm really interested to see if we can harness the power of raw cannabis and, maybe even raw hemp of sorts, because of the lack of the THC in there, that we don't even have to worry about it becoming decarboxylated and becoming dysphorically psychoactive. And those are things that I am the most interested in harnessing as time goes on. For example, we've used, superfood greens forever now, both from generations beyond, thousands upon thousands of years, where plants were not changed in their chemical composition and formulation. So they haven't. I wouldn't say that there has been something that I could say out there that there's a novel product line of application that could be used one or the other. But keeping it as simple as possible, I guess, would be what I recommend. Using the plant for what it is. It's a multimodal entourage effect plant that has all these amazing molecules that synergize with our bodies in more ways than one, and also at the same time help to neutralize any potential side effects if one molecule was used by itself over another.
Great. There was someone who had some experience with giving their dog a different dose than you recommended in your presentation. The question was, do you have any more information on variable dosing?
So variable dosing was, like I said, we literally have 2 research articles out there that I know of that are, and there's, don't get me wrong, there's actually several more going on right now, at least in America though, that I know of. There's 2 that have been published that are prospective, that have an actual dose listed. With that said, all of the factors we tied in today is why I'm here. We need to promote first the general education. This is something we need to do, but no, I would say I've heard stories of animals improving from what I would have thought after the time of, the months to years of studying that I've done, would have been completely a waste of time. But I have found that, for example, in sometimes older animals, a 5 milligram or 10 milligram or 15 milligram dose is substantially effective in the increased quality of life for an animal, for example, that has arthritis. They will have great days consistently versus having those fluctuating good day, bad days that we'll see as dogs get older. And so, in areas of concern or interest for me as time goes on, continued chronic arthritis control, canine dysfunction, cognitive dysfunction syndrome, so essentially dementia for dogs, atopic dermatitis, which is essentially allergic skin disease, seizure control, again, idiopathic seizure specifically in young animals. All these conditions, immune-mediated conditions, all these things are going to be, potentially have different dosing that is required. So there, again, will be no specific answer for that, because in our world of Western pharmacology right now, there are different doses for different conditions. And that will be the same for cannabis as well. But it's about understanding that this plant is, in the root of it, one of the safest options, at least proven yet, as we have no reported deaths. And that's something we can fall back on no matter what. So starting low, going up slow, as we've, the colloquial phrase has been, that's the way in which I can say right now is the only way I can think of it. But I personally cannot recommend, no matter what, whether it's in this form or not, a specific regimen of how to apply cannabis at a dose, a frequency, a formulation, etc. This is merely an educational platform for neutral, vital information, harm reduction education. And so no, but that is, of course, something I'm looking for in the future that we can really get a better handle on and apply to certain conditions.
Great. We did get a question about getting a copy of this presentation. We will house it on the NCIA YouTube site, and we'll email a link out to it afterwards to all the registrants. So everyone should have a copy of this presentation. It looks like we don't have any more questions right now. Anything you wanted to wrap this up with, Zach, before we close out?
Honestly, I really think that we covered a lot today in the general platform. Every conversation that has been brought up in humans should and can be brought up in animals as well. So when it comes into specifics, that time will tell when we can start to answer those questions. But overall, I really am ecstatic to be here today. I'm glad that there were some feedback questions. I saw a response in terms of a couple other companies that have veterinarians helping to run them from the background. That I would love. I actually reached out to Canna Companion a little bit while back, which is great, and didn't get really any response. So I'd love to reconnect if that was possible. And then for the other companies as well, I'd love to hear exactly what the veterinarians are doing there to help with advisory in a safe, effective form. And as time goes on, the veterinarians that listen to this really hope this was helpful. For the pet parents that listen to this, again, really hope this was helpful, and knowing that, there are products out there that we can trust. It's looking for those specific categories and qualifications that I kind of touched on. But overall, it's exciting to be on the forefront. And any other questions or concerns, definitely feel free to reach out to me on the ways that were described and through email and phone. And really happy to be there.